Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, it is finally time to talk about amputations.
Oh, boy.
Yeah. And believe it or not, there are a lot of people who have had a part of a limb or an extremity removed. Almost 2 million Americans are living with amputations. Of course, amputation is the surgical removal of all or part of a limb or extremity. An arm, a leg, a foot, a hand, a toe, even a finger. The Amputee Coalition of America estimates that there are about 185,000 new lower extremity or leg amputations every year in the United States, about 1 million worldwide. That's one every 30 seconds.
Man, there are multiple reasons that an amputation may be necessary. First, poor circulation from peripheral artery disease, or PAD, and the majority of those patients have diabetes. Less common reasons for an amputation include severe injury or accident, or occasionally for cancer. No matter what the cause, amputees face not only physical challenges, but emotional and social ones as well. Amputee rehabilitation is a big part of the whole process, and here to discuss is Dr. Karen Andrews. Dr. Andrews is a member of the Department of Physical Medicine and Rehabilitation and is the director of the Wound Healing Clinic and chair of Amputee Rehabilitation Services at Mayo Clinic.
Well, that was such a long introduction. We hardly have time to ask any questions. Yeah.
Thanks, Dr. Andrews.
Yeah, great to finally have you on the program.
Yeah, great to be here.
So tell us what it means. What's your job involved as a rehabilitation specialist at Mayo Clinic? Mayo Clinic.
So I'm blessed that our department is fairly big, so I can focus on the care of people with wounds and amputation through the continuum of their care.
And you're also involved in the wound clinic, director of the ulcer and wound clinic. So what happens there?
So the wound clinic is part of the vascular center, and wounds are a manifestation of an underlying disease process. So what we see is vascular wounds.
So blood vessel, related to poor blood flow.
Blood circulation, yep, exactly. It could be also wounds related to vein disease, any vascular disease.
Okay. And you treat these you've got multiple ways you can treat these to try to prevent somebody from having to have an amputation?
So that's why it's beneficial to be in the vascular center. We have interventional radiology, we have vascular surgery, and for treating their wounds, we have multiple wound products and modalities that we can use.
The two of you must have worked together a lot over the years. And how is it that what you spend your whole career doing, amputations, we don't talk about more often on this program?
Well, not my whole career. Well, the interesting
That's
part of
what
this...
I tell my kids.
Yeah, I'm sure you do, but you don't have to tell them that. But, we used to do amputations for kids who had bone cancer. Mm-hmm. We rarely do that anymore because now we have chemotherapy and better ways to take the tumor out and reconstruct the extremity, the arm or the leg. But there's a lot of peripheral arterial disease, particularly with the epidemic of obesity and diabetes, and people with diabetes get bad blood vessel disease, and that's why I didn't try to grow this practice.
No, I kind of forced him to. I said, "You did amputations. Could you see this person that needs an amputation?" "No, I'm an oncologist."
No, I don't do that stuff.
So the most common reason for amputation, you do agree with what he's saying? Is
exactly.
It
So there are multiple different reasons, but now it's typically the complications of diabetes, which can be neuropathy and peripheral arterial disease.
So neuropathy, explain that for our listeners.
So with neuropathy, people with diabetes have decreased protective sensation, and so they can literally walk a hole in their foot without realizing it.
Yeah, bad problem. So it's a double-edged.
Exactly.
So they've got poor blood flow and they have loss of sensation. And those two things together can easily create a sore on the foot, and sometimes you can't heal it in the wound care center.
Exactly.
So then you and I have decided, we're a team.
Yeah, absolutely.
Decided that someone needs an amputation. Tell our listeners how you and when you become involved.
So sometimes it's a patient that I've seen in the wound center that unfortunately we have not been able to heal, but a lot of times It's somebody that the orthopedic surgeons may ask us to see before amputation. And what I do is I first talk to the patient about what to expect following amputation. It's a big deal when you're told you need an amputation. And so to go over and sort of reassure them that people can do well following amputation. And then I also talk to them about what their level of function is to try to get a feel for what level of amputation would be best for them and how they'll be able to function after the amputation surgery.
And then once we get the wound healed, no matter what the level of amputation, but most of these patients have amputations below the knee or sometimes even above the knee, then they go to Amputee Clinic.
Yes.
They're all healed up. They're ready to get a prosthesis. Tell us how that works.
So it usually takes about 6 weeks for the incision line to heal. And then once it's healed, it depends on the level, but for the below the knee level amputees, it usually takes a week to make the artificial leg and a week to train them to use the artificial leg. So in 2 months, we expect people to be up walking safely at household distances.
I'm surprised it only takes a week to learn how to use it.
Yeah. That's learning how to walk safely at household distances. It's sort of like learning how to ride a bike. You'd know basic skills of riding a bike, but getting your hands off the handlebars and optimal function is more like 6 months.
And the prosthetics are so much better than they used to be. I mean, there are a lot of people in this country, in this town, who are walking around with a prosthesis following a below knee amputation, and you really can't tell it.
Absolutely. You would have no idea. And so we show people videos or allow people to talk with peer visitors so they can get a feel for what to expect following amputation.
The emotional piece of that, you kind of touched on that, but what do people commonly go through emotionally when they have a prosthetic?
So it depends person to person. We have a lot of resources available to us. Adjusting to an amputation is like adjusting to loss of a family member. You go through a grieving process. So psychology is available if needed. The Amputee Coalition America that Tom mentioned earlier is a great advocacy group for people with amputations. And we also try to set up people with peer visitors if they think that would be beneficial.
So tell us about what's the most rewarding part of your job, day in, day out?
So people do so well at the end of this process. And so it's just so rewarding to see in 2 months how well people can do when they may have been suffering with whatever disease process may lead to the amputation for years.
You know, I would say that some of the most grateful patients that I have and that I share with Dr. Andrews are not the patients that you've cured of cancer, but the patients who have had an amputation because they've struggled with a sore and pain and malodorous wounds for so long. You remove their limb, they get a prosthesis, they're up walking. Those are some of the most grateful patients we have.
Exactly.
Dr. Karen Andrews, rehabilitation specialist at the Mayo Clinic. Thanks so much for being with us.
Thank you.